Juicy. Yeah, you juicy peach.
Hi, how are you? My name is Chris. I'm a physician assistant here at Ethos Aesthetics Wellness. On this lovely patient today, we're doing a little bit of filler. We're going to be using Juvéderm Voluma, which is indicated by the FDA for some temporal hollowing. I marked out some of her anatomy. We also prepped and cleansed her skin. For the temples, I like to use something called a cannula technique. I'm going to be making a pilot hole to create place for the introducer for the cannula. So again, I marked out her temporal crest and areas where I would like to focus on for some volume correcting issues. You feel a little pressure, maybe hear a little pop. You okay?
Yeah.
Good. Okay, just introducing the catheter. A little pressure. Any pain? You're okay?
I'm fine.
Beautiful. So I'm just creating a little bit of volume. We're looking to replace lost volume, not to create volume that never existed with hyaluronic acid filler. Okay. And when we create volume back in here, it gives us a more youthful appearance and consistent with normal anatomy. It will also help reposition some of this tissue down here by creating some lift in the temple space. This is one of my favorite areas to treat. It's often an area that's overlooked by most, and once we actually restore some of this volume that we lose, and even in areas that are more of a concern for a patient like the nasolabial fold, as well as this pre-jowl area, we'll actually get a subtle improvement from the temple just being filled. It's a pretty nice trick. Not too bad, right?
At all. I don't feel
What a dip. So we're almost done here. Patient typically will feel a little bit of pressure, sometimes a little bit of like a popping sensation. In general, it shouldn't be overly painful. There might be a little twang of pain here or there, but overall, it's a well-tolerated procedure. You can certainly expect a little bit of swelling and bruising with introducing any type of needle to the face. That's certainly a possibility. But overall, minimal downtime. In general, I do prefer the cannula technique. I do think there's a lot of the advantage to the downtime with treating a cannula, but every injector is going to have their own preference. So let's see, looking pretty, it's really good. So you can see even just the subtle lift of the eyebrow just from a little bit of that filler placed in the temporal crest region. And then where she was slightly hollow, we expanded some of that volume to overall correct that volume loss. And then next I'm going to place a little tiny bit of filler in the medial portion of her cheek just to reposition some of this tissue down here. By just a few drops of filler, that will make all the difference. Okay.
Yeah, I'm fine. Yeah. That's juicy. Yeah, you juicy peach.
It does, right? I can see that.
Yes, me too.
Yeah. I access the temple. I'm just going to reverse the cannula just to kind of access this portion of the cheek. So we don't have to worry. You're going to feel a little pressure and a pop. Good. You're okay?
I'm fine.
Good. So just, we're going to add a little drop of filler, again, just to reposition that tissue ever so slightly. Beautiful. And again, that just gives her a little bit of volume in this area, again, to offset this shadowing she was getting, as well as to pull back the jowl a little bit and to blunt that nasolabial fold. A little bit more deficient on her left side of the temple. We're gonna sprinkle a little bit on the right just to even things out. Same thing on this side. But overall, we were able to achieve these results by just one syringe of filler. Again, this isn't her first syringe of filler. This is more of a little bit of a maintenance. Here, I just kind of reversed the flow of the cannula. So where I was accessing her temple, I was coming in through this way, and now I just repositioned my catheter for the cannula. I'm gonna feel a little pressure and a pump. And again, I'm just looking to put a little tiny drop in here, and you can see what that does down here. I'm just gonna emulate it with my finger. So we just wanna add a tiny little volume again, just to recreate that lost fat pad that happens with age. Beautiful. Good. Looks so good. So take it easy for 24 to 48 hours. Wash your face with a gentle cleanser. She can apply a little bit to these pilot holes, topical antibiotics such as bacitracin if desired, and then take it easy with exercise. No vigorous, strenuous, weightlifting, just for about 2 days.